Hi, and welcome to Living with MS. My name's Liam Senior, and in 2018, I was diagnosed with relapsing remitting MS. If your life's affected by MS in any way, then this channel is for you, so please consider subscribing. In this video, I'm going to be talking to you about DMTs, or disease-modifying treatments. It can be really overwhelming, and you can be inundated with options when you're first discussing with your health professional what disease-modifying treatment and treatment path you're going to go on. So when you're trying to make a decision about what DMTs to go on, it's important to do a bit of research and talk to your health professional. There are currently more than 20 different DMTs available on the market, and deciding which one is right for you can take some time and thought. Disease-modifying treatments aren't a cure for MS, but they can reduce the amount of relapses someone has and how serious they are. They can also reduce the damage caused by relapsing remitting MS over time. So when your healthcare professional presents you with a list of different DMTs or DMDs that are available to you, there are some important factors to consider. Firstly, it's how are you going to take the DMT? So different disease-modifying treatments are ingested, I guess, in different ways. So when I first started my treatment path, I began taking Tecfidera. Now, Tecfidera is a disease-modifying treatment that's taken in tablet form. It's taken every morning and every evening, every day. After I'd had a course of Tecfidera, I had my regular follow-up MRI, which did unfortunately show signs of quite aggressive progression. So having then had a conversation with my MS nurse and my neurologist, I was then moved on to Cladribine. Cladribine, it's almost a chemotherapy, but taken in tablet form. It was originally developed to help with, I believe it's sickle cell leukemia, but I could be wrong. Let me know in the comments if you do know, because I'd be interested to find out. So that is a tablet that is taken over quite a strict course and routine based on different factors from your scans and information, your weight and anything like that. So when mine was sort of assessed, I took a tablet every day for 5 days before I then had, I believe it was 3, maybe 4 weeks off. I then took another 5 tablets for another 5 days, and then I had 12 months off. I then repeated that cycle, so 5 tablets over 5 days before 3 to 4 weeks off, and then another 5 tablets over 5 days. Following that, you're still within the course of treatment. So I'm into years 3 and possibly going into year 4 now, where I'm not actually taking anything. So I'm still getting my bloods done. I'm still getting MRIs and things like that to check things are okay, but I'm not actually taking any more tablets. So that's another thing to consider when choosing your DMT, but I'll come on to that in a moment. One of the other options you can have is injections. Now, these can be daily or twice daily injections, where you administer them yourself. You'll get a sharps bin, you use needles in there, and then they'll get collected. So yeah, some I believe you take maybe once a week, maybe once a month, and then there are some that you take every day, sometimes twice a day. And they're injections usually in your leg. You can alternate if you're getting some swelling and things like that. It's not something that I've gone on to, and that's not necessarily due to any aversion to needles. It was just that out of all the options, having not really worn well with Tecfidera, Cladribine was advised to me due to the nature of my MS. The third type of disease-modifying treatment that you could have is an infusion. So a friend of mine that has MS, I forget which one it is, but once a month he goes to his hospital, his local hospital, and he'll have a drip attached to him intravenously, and then that treatment will go into his body, and then he'll be taking nothing else for the rest of the month, and then it repeats. So one of the first things therefore to consider is, if you don't like needles, then that's something to consider. If you're not great at taking tablets, then that's something to consider. Or if you don't fancy having to go all the way to the hospital once a month to sit there with a load of other people, then that's something to consider, and weigh up the options. You prefer tablets or needles or infusion, and have a little think about how you're going to be taking them and how that might sit with you. Another thing to consider, as we've already touched on a bit there, is the regularity of your treatment. So is it going to be something like Cladribine, where yes, okay, you have quite a strict structure for a few weeks, and then you have most of the year and a couple of years at the end where you're not taking anything? Or do you think, well, actually, if I'm not taking anything, I don't feel like I'm doing my bit, so I want to be taking something a little bit more regularly? So yeah, is it something that you're gonna have to take every single day? Is it something that you're gonna maybe just do once a month? Or is it more of an aggressive treatment that's kind of one and then done? So something else to consider and discuss with your nurse or your neurologist. With all that considered, there are some people who decide not to go onto any course of treatment whatsoever. They decide to manage it themselves through diet, manage things naturally through diet or exercise plans and vitamins and things like that. So yeah, it is worth considering as well what other options are available to you. Something that I'm going to cover off in another video will be how to manage your MS naturally or organically, or other things that people have done that have helped their MS, either alongside or instead of disease-modifying treatments. So look out for that video in the coming weeks. I'm also going to leave a link in the description to the MS Society's website, the MS Society here in the UK. I've been doing a bit of reading on disease-modifying treatments in preparation for this video, and it gives a big list of all the DMTs that had been withdrawn and ones that are currently on the market. So yeah, it's good to have a little look at those, particularly if you are making a choice of which disease-modifying treatment to have, and to do a bit of research on things like your possible side effects. There's loads of different possible side effects that can be caused due to DMTs. These can vary from things like hot flushes, nausea, there's loads of other different things, and each one's sort of a bit different. So once again, you might find a disease-modifying treatment that you want to work with, but then you read the possible side effects and think, actually this isn't for me. There are also a lot of different medications that are available to you as an MS patient if you discuss with your nurse and your neurologist. There's lots of different medications that can help to treat or ease the symptoms that come with MS. So for example, I take 1,800 milligrams of gabapentin every day, which is a nerve painkiller. Basically, it's for a painkiller for nerve pain, and it also helps a little bit with depression. And then I also take 60 milligrams a day of duloxetine, which is sort of the other way around. It's an antidepressant that also helps with nerve pain. So it's kind of like a bit of a cocktail of the two there to help with my mood, but also help me with a lot of pain that I get in my legs. So I get lots of electric shocks and tingling and numbness and fatigue in my legs and across my body. So that kind of helps with that as well. So it's not just your DMTs that you need to consider, but is there anything else that could be helping you along the way? Another thing that's recommended to me by my nurse is to be looking at vitamins. Now, there's a real link between MS and vitamin D. So I'm currently taking 4,000 international units of vitamin D every day. I'm not quite sure what the recommended dosage a day is. I'll pop it on screen, but as you can see, the 4,000 international units that I take is a huge overcompensation, I guess, for vitamin D, because with those links between MS and vitamin D, it's important to sort of get as much of it as you can, including going outside, getting fresh air and the sunshine will help, but this will help me give me a little boost as well. I also take a vitamin B sort of multivitamin with all the different vitamin B options, B12, B6 and all those ones, because there's a link there with fatigue, and there's lots of crossovers between symptoms of MS and vitamin B deficiency. So having making sure I'm getting all the different types of vitamin B that are useful to me has been really helpful as well. So lots of different DMTs that are available to you. Do your research, ask questions to your nurse or your neurologist about what is right for you. Also look at the alternatives to that, including your pain relief and other medication that might be available to you, your vitamins and your diet, things like that. All together, I suppose disease-modifying treatments aren't the only thing. It's about managing it completely and holistically to make sure that you're covering all bases. And as I said, for some people, DMTs, not for them, they're not interested. Absolutely fine. So, but if it is something that you think is going to help you, or your neurologist and nurse has recommended that you go on to a course of DMTs, then do your research, ask your questions, and make sure that you're comfortable with what you're going to have to take. Consider other pain relief and other medication that's available to you that might be recommended, along with your vitamin supplements and things like that, because they will really help. As I said, it's not the be all and end all. There are other alternative things you can do. I'm going to cover off things like diet and other things that naturally help with MS, or things that I've picked up along the way that have really helped me. So again, watch out for that video. I hope that was useful to you, even if you have been on disease-modifying treatments for ages. Let me know in the comments what you've taken or what you take, what was good, what was bad, what's helping, what didn't help. If you've got any questions about DMTs and you're recently diagnosed with MS, or you haven't started treatment yet, drop me a comment. I might be able to give my opinion, but as I said, make sure you're speaking with the right people as well, your healthcare professionals, because ultimately they've got your best interests at heart. If this video was helpful, then don't forget to hit that like button and subscribe if you haven't already. I'm enjoying doing these videos. They are helping me sort of manage my MS mentally, I guess, and hopefully there's been they've been helpful to you as well. And it'd be great to have you along the journey. I'm going to drop another link, in the description for a Facebook group that I've started, also called Living with MS. It's a private group aimed specifically for people who are on this channel, so that we can perhaps have a bit more of a chat outside of the comments, and we can get your suggestions and maybe even get some of you on the videos in future. We're going to perhaps, I've got the mic, we can do some more podcast format type videos and get to know your story and how you're managing your MS and what that experience has been like, and any tips and hints, things like that you've got for other people. So once again, thank you for watching the video, and I will see you in the next one.